You're watching the latest edition of the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you are considering any type of facial rejuvenation. My first guest is Beverly Hills' hottest cosmetic dermatologist. If you are unhappy with the way you are aging and not quite ready for a facelift, my advice, stick around for the latest edition of the Wellness Hour.
The Wellness Hour, an in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. My first guest is Dr. Simon Ourian. Dr. Ourian is the founder and medical director of Epione, one of the largest cosmetic surgery centers in America. He is here today to discuss what's new in minimally invasive facial rejuvenation. Dr. Ourian, welcome to the program.
Very nice to meet you. Thank you for having me.
Now, before we get into today's topic, big topic, by the way, tell us about your center. I mean, it's a large place in Beverly Hills.
Well, we'd like to think of it as a boutique large center. Although it's large, we see a lot of patients, but we want to make sure every patient who walks into our office feels like they're the only person there. So from the moment you walk in, you are taken care of and you're taken to your room, and we really treat it like this is a 5-star hotel and 5-star facility. That removes a lot of the intimidation that patients may have. And
it can be intimidating going into a surgery center. Everybody looks great.
In many ways it is. You're going to a place that everybody is there to look better, and most patients don't want to admit that they're there to because they want to look better, because let's face it, nobody wants to be called a vain person.
Yeah.
So they come in and some people are intimidated, but the truth is we try to remove a lot of that feeling of uneasiness by taking patients to the room and making them feel as comfortable as possible, and then spending a lot of time with them, giving them a lot of questions, answering their questions, and bringing up new questions in their mind and see what we can answer and to make them feel better and give them all the information we can.
Now, your background, your training, UCLA, went on to Harvard Medical School. Tell me about it.
From the beginning of my career, if you can call it, when I was 10, I really wanted to do something that instantly could make changes in people's lives. And cosmetic dermatology over the years became the path for me. I was always good with my hands. I was artistic. I did a lot of sculptures, and over the years I decided to take this path and spend more and more time with it. And as the lasers became more available, I found myself getting more drawn to them because they seem to be the future of the medicine and the future of all the cosmetic procedures.
You invented one of the lasers, is that correct?
Correct.
And you hold the patent?
I hold the patent on the Coolaser and on
the
Coolaser.
Coolaser,
yes.
Okay.
I'll tell you a little bit about Coolaser. It is the laser that is used the most to remove fine lines, discolorations, some of the sagging of the skin, a lot of the signs of the aging that we get over the ages of 20 and 30 and 40 from the sun damage, from the environment, and from just aging.
Okay, now how is it different than intense pulse light technology or IPL, things like that? Well, is it the same thing?
No, it's not the same thing. There are many different variables of lasers you can use for different treatments. You can use lasers to remove hair, to do vein removal, to treat spots on your skin, to remove wrinkles, and each of these lasers are geared to a particular problem in your skin. Coolaser came out of a lot of frustration that I had with the lasers that were available 5 or 6 years ago. We only had CO2 and erbium laser and perhaps a few other lasers that really didn't work. So all we had were things that were really, really effective, like CO2 and erbium laser, but had a lot of side effects, or lasers that were not effective at all, but they didn't have side effects. So there was no marriage in between the two. I worked with a lot of the manufacturer of the lasers to try to find out what is the laser that we can use that has the best of both worlds, not as much side effects as the effective lasers, and still give you the effects that you want. I worked with a lot of Asians, African American, Mediterranean, olive skin, Latin skin people who could not do these other lasers, the CO2 lasers and the erbium lasers, nor could they take 2 months out of their life to try to look better. Now, Coolaser basically came out of that frustration and trying to make the lasers work.
Is it that much better than what was available?
It's a lot better. Yes, you do. If you imagine, if you
so
don't
the results are better, much better.
Results are as good, if not better, than the older lasers. But the best part of it, in my mind, is that there is no downtime, there's no anesthesia, there's no huge pain that you used to go through from the other lasers, and the results are very effective and very natural looking.
Who is your typical patient? What type of patients are you seeing for some of the laser stuff? The cool
Our
laser.
typical patient is a person who wants to look good. Any person who wants to look better comes to our office. I think looking better is a very natural, very healthy, very psychologically healthy part of a human nature. We want to look better because the very first face that we see in the morning is our own face. And we want that face to be the best one. And we remember 5, 10, 15 years ago when we weren't working this hard, when we hadn't put all our youth into working and a bad marriage and everything else and raising the children. And you remember that picture. In your mind, you still look 25 years old, but your face and the mirror tells you something else. So those are my patients who come in and they want to look a little bit better.
More women than men?
Probably 70% women to 30% men. Of course, women are more geared to this, but nowadays men need to look better too. I wake up in the morning and I don't want to look 10 years older.
Yeah, you look good. Your skin is really good.
I am a walking advertisement for myself. I do things that I think are safe, effective, reversible, predictable, and are going to give me results that I want. And this is the same thing I would do for my own face. I'll do it for my own patients.
So you do fillers? I mean, you do everything.
Everything that's available in the market.
I should mention, by the way, the manufacturer says that you are, if not number one of the busiest users or number one users of things like Restylane and Radiesse and things like that. Is that true? Is that right?
Depending on year to year, we are either number one, number two. I don't know how many we are, at least in the top 5. I know that for Botox in the past 10 years.
How important is that to the patient? I mean, experience makes you that much better? Obviously.
Of course, like everything else. I mean, if you paint the walls, if you do it for 10 years, you become really good at it. So it's experience that tells me if a patient is going to have good results right off the bat. I can tell them, you know what, you may not be a good candidate for Botox and or any other procedure. There are patients who come in, 30% of the patients who come to our practice, we turn them away. We say, this is not the right procedure for you, or the procedure that they came in with in their mind is not going to work for them. I have patients who come in and they want to have huge lips. I am not going to do that. You
don't like that look?
Not that I don't like that look.
Who likes that, by the way? Because I don't know anybody that likes that. Is it the doctor? Is it the patient coming in saying, this is what I want?
I think in most cases, and I've experienced this, in most cases patients come in and they say, you know what, I want to have big lips. Now, if you can be easily intimidated and manipulated by the patient as a doctor, you are going to end up going to do the treatment. So you're going to go ahead and do the treatment and patients end up with a big lip. I don't need that. Every time I do a treatment for a patient,
you like it look natural?
I like it to look natural, look their absolute best. They are going to be my walk-in advertisement. I'm not going to put my signature on a big lips that they look like something that walked out of a cartoon. I want people to look their absolute best. A lot of times I tell patients, bring your pictures with you, and if I see the pictures from 10 years ago, then I can adjust it. I say, you know what, you had a little bit of a fat deposit in your cheeks. This I can melt. You have a little bit of the loss of tissue here. We can fill this up. You have sun damage. We can do Coolaser for your face. And all these procedures, in most cases, don't take more than an hour.
Can you take off 10 years? I mean, do you ever hear that?
We do that all the time. Every day.
People can look 10 years younger.
10 years, 15 years younger. Of course, looking younger is just a lot of it is scientific. Your face hasn't changed. It's not like the bone structure has been taken out of your face unless you had a major disease. Things that have happened to your face have been only a micromillimeters. And we can control this. We can raise the eyebrows a little bit. Again, non-surgically. We can raise the eyebrows either with Botox or with fillers or with lasers. We can tighten the skin. Imagine, if you will, laser is similar to getting a saran wrap and put it in a microwave. We can shrink it and tighten it to your skin.
So this cool laser, help me understand how it works. Penetrates the skin. How is it tightening the skin? What's going on?
Our skin is made of collagen, elastin, and other fibers. So by heating this tissue underneath the skin without causing superficial damage to your skin goes into a shrinking mode. And all this collagen that has become loose over the years literally shrinks and tightens your skin. The beautiful part of it is that it is not going to over-tighten your skin. You're not going to end up looking like that tight deer in the light look. It's going to look very natural, and everyone who sees you is not going to be, no one's going to tell you, nice facelift.
Right. Now, it's a cool laser we're talking about.
Yes.
Does it have radio frequency as well?
No. Coolaser is a laser. The advantage of it is
Does
that
your
it's a
face peel?
diffused. Yes, you're going
Okay.
to do a lot of the peeling during the actual procedure. You are going to turn a little bit red, not as red as the CO2 laser or some of the predecessors of these lasers. You turn a little bit red, a little bit of a downtime. Depending on how deep we go, we can control your downtime and control your the amount of results you're going to get. Of course, if you want the more results you want, the deeper I go. But the huge advantage is that I could really dial it in. I could go slow and kind of walk with your skin, work with your skin, and find out what it is that is going to give you the best results possible.
So sun damage. It's
Yes.
great for sun damage?
The best thing I have found for sun damage is to remove the top layers of the skin. Now, you can do it with a sandpaper, which of course I don't recommend.
Right.
Now, if you do anything traumatic to your skin, you could really do serious damage, because a lot of patients come and say, "Oh, I just found out I could remove the top layer of my skin. It's going to remove the top sun damage," but that's going to give you more damage plus the sun damage, because your skin has memory. So we have this technology to remove the sun damage, the freckles, the discolorations, the fine lines, large pores, even acne scars. Randy, we have patients who come in with acne scars.
You can take care of acne scars.
Absolutely. Absolutely. This is the best treatment I have found for acne scars. And we see everything from 20% improvement to all the way up to 100% reduction, complete eradication of the acne scars.
With the Coolaser.
With a Coolaser. What we are doing is that, number one, we are removing the top layers of the skin, and by stimulating, by agitating the deeper layers of the skin, by this heat that laser creates, without damaging the surrounding tissue, it gives your skin the thumbs up or the jolt to go into a overproduction of new collagen. And
So you rebuild new collagen.
Exactly. We know our body builds collagen every day. As we get older, this process of building collagen slows down. Now, if we could find, we always thought, if we could find a mechanism that we could turn that stem cell back on again to make it go back to build new collagen, we could stay young all the time. We're not there yet, but we're almost there. We can turn the stem cell back on to kind of give it the message that, listen, we just got injury here, and this injury is controlled. So you're not going to have a long-term recovery. But your skin cannot distinguish between the two. So it goes into an overproduction of new collagen. You get nice skin.
I mean, you know the skin. You're a dermatologist. Do you have a bias?
Dermatologist.
Yeah. Do you have, as a cosmetic dermatologist, do you have a bias? Do you feel like that people should go to a cosmetic dermatologist if they're going to do something like this? And also somebody that has all these lasers.
I think patients should go to the person who has the most experience, and the person they can find who has the most experience, who has done more treatments, who has worked with their type of skin type. Not all skin types are the same. Not all skins are created equally. And do your homework. Ask your friends, ask your colleagues, ask your other doctors. What is the reputation of this doctor? Can I trust them? Is this the doctor who's going to make me look better, or going to make me look not that much different for all the time and money that I pay him, or worse, make me look a lot worse than I started with? And this is what you have to spend time and effort and energy into, to do your homework beforehand.
Now, you're in Beverly Hills.
Yes.
But you told me on the telephone, you get regular folks. I mean, you get regular people coming in, not just the high-end crowd. I mean, you have the celebrity crowd, you get regular people.
We have everything from people, from dignitaries of the heads of states, all the way down to a person who just wants to look a little bit better. Is a universal desire to want to look better. And the one thing that puts a block between a person and a doctor to make him look better is the fear. And what we do is that we give them enough tools.
So what are they afraid of, by the way?
Nobody wants to look like somebody else. Nobody wants to look like a monster or some masked face. You want to look like yourself. You want to look natural. And we all have seen bad facelifts. We have seen bad laser lifts. We have seen bad procedures.
Yes.
No, you don't want to look like that. So these fears keep you away. You're like, you know what? Most patients say, I want to leave the good enough alone. But the truth is, you can do little things. You don't have to do major procedures.
With what you do, by the way, we're talking about the Coolaser. Are you combining those procedures with fillers and other things?
I prefer if I do a lot of different procedures, but do little of each. Because we don't age in one area. You're not going to just one day wake up and you have a sagging skin. You're not going to wake up and have just lines and have a perfect face.
All right.
Things happen slowly and little things at the same time. So I like to just combine different procedures to create more of a natural look.
So earlier treatment is better? obviously?
By all means, to a degree. I'm not going to try to treat a 17-year-old who has no wrinkles and no lines. But as soon as you start to see that your face is sagging, you start to get wrinkles and you have discolorations on your skin, and if this is the right time in your life, I don't want to get patients who are depressed and say, you know what, I was depressed and I decided to do this. This is not the right, those are not the right times to do treatments. You should be in a good point of your life. You should.
What about 60-year-olds? 60-year-old female, that's young today.
Absolutely, yes. This is
this Coolaser will work for them.
Right. And let me tell you, my oldest patient was 97 years old, and she looks great, and I didn't have to do any surgeries for her. She just wanted to have her wrinkles removed. And she's the youngest 97-year-old lady you've ever seen. She looks like she looks and acts like she's in her 50s.
Okay, we're going to take a quick break. You have a lot of photos. I mean, you have from stretch mark removal to crow's feet, getting rid of crow's feet. So we're going to show those, and we'll be right back. You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. We're talking to Beverly Hills cosmetic dermatologist, Dr. Ourian. We'll be right back.
Even if you've never heard of Coolaser and you may not know what questions to ask, the consultant can actually give you information so that you can make an educated decision.
I had no actual pain with the procedure at all, and within a couple of days my skin started to peel and the skin underneath was younger, fresher, tighter, and people noticed a difference right away.
It makes me feel really, really good. I have often told the doctor that he has single-handedly, without cutting my face, made me feel beautiful.
This one was quick and was pretty painless, and probably the most dramatic results for the least amount of pain that you could expect from something like this.
Tried all sorts of cover-ups for bad breath? Try the science of BreathRx. Only BreathRx has Zytex. It attacks the cause of bad breath, keeps working for hours. It's clinically proven for real fresh breath.
Get non-prescription BreathRx from your dental hygienist and now at fine stores everywhere.
There's a new secret to looking younger. An advancement so profound, it took a team of scientists years to create. A time machine called Zoom. Getting zoomed is the fastest way to erase years from your looks. Zoom is the most advanced teeth whitening ever. Only your dentist has it. Nothing works like it. Zoom Gel gently penetrates the submicron pores of tooth enamel. The patented Zoom Light superactivates the gel through a unique photofenton reaction, breaking down the stain's double bonds. In just 45 minutes, years of discoloration disappear, transforming your smile to wow. To find a Zoom dentist near you, go to zoomnow.com or call 800-891-4895. For your whitest, most confident, most irresistible smile, get zoomed today. Make your appointment at zoomnow.com or call 800-891-4895 today and discover the wow of Zoom.
You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. We're here with cosmetic dermatologist Dr. Ourian. Okay, you brought some photos. What are we looking at here?
Well, one of the first things that I wanted to show people is that by using fillers, we talked about doing lips and making them look natural. These lips are really one of the things that I enjoy doing, and I take a lot of pride in doing perfect lips. For two reasons. Really? I do it gradually, and I work with the patient's lips. I don't try to create Angelina Jolie's lips on everyone. She's got beautiful lips, but they're not going to look great on everyone. So you have to work with the lips that the patients have.
Is it a tricky procedure, by the way?
It is very tricky. You're working with three-dimensional lips. I make it look easy, but it is really a tricky procedure. It's a three-dimensional. You have to make sure that the lips don't look artificial. You don't look like you're smuggling sausage between your mouth. It's just, it has to look nice and natural, yet it has to look a little bit fuller than it did before, and that's what people come to see. This is one of the procedures that I talk about. This is a very typical procedure of what patients come to see for the upper lip and lower lips, and they end up looking very natural.
So as you get older, your lips, everyone's lips loses volume? Is that right?
As you lose collagen in your face, you lose the volume in the lips too, and the lips are the first to show it. Lips get smaller, the wrinkles around your eyes show themselves first.
So is your goal to return them to where they used to be?
Make it how it used to be, and just a little bit of volume. You don't have to make the lips look like necessarily huge, but just make them look natural.
When I see the profile and you get that duck look,
duck lip,
was that by the technician? I mean, the person that did it?
It is.
I mean, do people want that?
Well, no, it is very technique dependent. So I don't think anybody comes to a doctor and says,
we've all seen it.
Well, this is why you need to go to someone who has done lips a lot and has done nice lips a lot.
Are you one of the busiest lip guys in Beverly Hills?
I think in the country I'm one of the busiest trees, so it makes me feel good, and
good.
That it's a pat on the shoulder. But more than that is every patient that I treat. If that one patient who's sitting in front of me gives me the 2 thumbs up, that's better than any manufacturer's letter that they send me. That is the one person that I want to make happy.
Okay, so what is this?
So this is a typical treatment of a Coolaser, a person who comes in and wants to just have discolorations removed.
It's a huge difference.
It is a huge difference. This is not like a regular IPL.
How many
or other
treatments
procedures.
to get this?
2 or 3. Usually.
And these are 5-minute, 10-minute?
5-minute, 10-minute procedures. You go home. And as you can see, you can do it on dark skin individuals.
That is a dark skin.
Dark skin on African Americans, on Caucasian, on
so an
Caucasian
African American,
Asian.
because I've been told you can't do it. They still haven't figured out the technology.
We have figured it out. We see a lot of, we have probably the largest population of African American ethnic skin treatments that we've done lasers on in our office, because of the fact that we really do it slowly, and we take a lot of steps to make sure that the skin is going to be protected. And the final result is that the patients end up with nicer, more even-toned skin, and the fine lines and the discolorations are removed. This is another patient who has Coolaser and fillers around the mouth. And as you can see, just a couple of treatments and just the treatment made a huge difference, and the patient ended up with nice results, very natural results, just the same as they
looks a little
walked in.
doctored up. I mean, it's really a huge difference.
None of these photos have been retouched. These are
so that was just with the Coolaser?
Just the Coolaser
no
and
fillers.
fillers.
Some fillers.
Yes, Coolaser and filler. Radiesse and Coolaser
Very
in this
nice.
procedure. So what happens is that the patient ends up with brand new skin, and the lines are removed. Remember,
is that an exaggeration? Brand new skin?
No, actually, it's not an exaggeration. You end up with brand new skin. We remove the old skin, which is sun damaged, but the dead layers of the skin. We're not going to remove the living cells. Remove the dead layer of the skin. So your stem cell, which is the catchphrase nowadays, stem cells go into an overproduction of building new skin to come out. So you end up with a healthier.
She had some smoker lines.
Yes.
And those are gone as well.
The smoker lines are gone. These are because of the fact that we did the filler and we removed it with the Coolaser. This gets rid of a lot of the discolorations. The next person that I'm going to show you is the person who had the Coolaser for her full face and also did a lot of the some of the dermal fillers. These are very simple procedures. Person comes in and out, and they go home. As you can see, no one's going to walk up to her and say, you know what?
Years.
Yeah, no one's going to walk up to her and say, you know what? You look done. Randy, most patients don't realize, most people don't realize that you don't age just because you have wrinkles or fine lines. A lot of it is sun damage. Now, people go and spend hours and hours putting makeup all day long. I tell them, once we're done, most likely you're not going to need to use makeup anymore, because your skin is going to be nice and even colored. You're going to have the same pigment here, and everywhere else in your face. Right? You don't have to cover up your face with different makeups. There's no lotion, potion, or any kind of makeup in the world that could do this kind of treatment. In fact, most medical procedures cannot give you the kind of even-toned skin that you get with Coolaser.
You say you could do chest too, is that right?
Absolutely. Patients who
have the bright red chest, I see.
We can do the full body. In fact, this is what happened a few years ago. We were treating the body for one of my patients who had discolorations, sun damage, all those sunspots that you get, and made her look really old. Although she was only in her 50s, her chest, because she used to play tennis, she's actually a champion tennis player, she had a lot of sun damage on her chest. As we were doing the treatments, we noticed that the stretch marks on her breast were removed. So we started doing more treatments, and now then we discovered that we actually can use a modified version of the Coolaser, which we call CoolBeam, and we patented this technology. CoolBeam. We can remove the stretch marks on the body.
Do you have a photo?
Since then, we have, yeah, absolutely. We have patients who come from all over the world to try to remove their stretch marks. And
oh boy,
there's.
Let me see that up close.
This
is amazing.
I don't care what procedure, what lotion or treatment you get out there.
How is it evening out that?
We get stretch marks when your skin grows too fast because you gain weight, you go through pregnancy.
How is it blending the color like that?
Because the fact that as we remove the top layer of the skin, this jolting of the laser that penetrates deep into the tissue causes the pigment to produce new pigment and even pigment all throughout your skin. So the new skin that is grown, the new skin that comes out with a brand new color, and the color is a lot more even. And also the cracks inside the body shrink. Remember, this is the same laser that we use to tighten the skin. The skin shrinks, the cracks become a lot less noticeable. So It really works. I wish there was some way for me to tell people.
Well,
there is a
women wear
treatment
lower
out there.
pants these days, especially in the summer.
And
it's a
they
look
come
now.
and they say, you know what? There's nothing I can do to cover my
Tummy tuck.
my stretch mark. There's nothing. Tummy tuck only covers some of these stretch marks. Yes, you can do tummy tuck, and in some cases, I can't do it with laser. We have to end up doing tummy tuck as well, but we still have to do the laser to remove the stretch marks. And what are you going to do for the stretch mark on your buttocks? What are you going to do for the stretch mark for your arms?
So this does everywhere.
This
obviously.
does treatment for everywhere and does it effectively. This is the most effective treatment I have found to this day. And I can say it very easily. The most effective treatment I have found to this day for stretch marks. And it does work anywhere from 10, 20, 30% per treatment, all the way up to eradicating the stretch marks.
So on a consultation, you meet with a patient. What are the frequently asked questions they have for you about lasers?
But one of the things patients ask is that the number one concern they have is that, am I going to look like someone else? Is it going to damage my skin? I have heard my so-and-so friend did laser 10 years ago and they didn't like it. The truth is that they are going to like it if they follow the regimen, if you give them they are the right candidate, and we walk them through those steps. A lot of patients come with a long list of questions. There's a website everywhere. People can come with it, and I encourage it. My best patients are the ones who are well educated, who have done their homeworks and can tell the difference between a good procedure and a bad procedure, and an experienced doctor and a not so experienced practitioner.
Final message. Somebody that is watching this, they're not happy with the way they're aging. What's the first step?
Find a doctor you can trust. Go in, talk to the doctor, find out their experience, their background, what they have done.
And for the skin, they should see a dermatologist?
They should see a dermatologist. For their face, they should see a plastic surgeon. They should see somebody who has had a lot of experience, who can get the results that they are looking for. This is a procedure. You only have one face. Make sure you do a lot of homework before you trust it to someone. But take a step. You are going to be happy. And that's what you need.
So in your opinion, they call the center and should they say, cool laser? I mean, should they ask for it by name?
Well, if they call a center or any center, they should ask for the procedure that is right for them. I don't think the patients should just go in and say, I want to have cool laser done, because it may not be the right procedure for you. But you can ask questions about it. You can go online, do research. You can go to a doctor.
But do you think they should go to a doctor that at least has it in their arsenal, as they say?
Yes, you should have a doctor who has the best results come from a doctor who has a lot of tools in their arsenal.
Okay.
If you have only one laser, chances that you're going to get the best results, you should be very lucky that that laser is the right laser for your skin. We need to get the best arsenals out there. We need to get the best tools that I could offer to my patients to get the best results. And every day I'm looking to get what else is out there that I could get best results out there.
Okay, great. I want to thank you for coming on the show. Very interesting.
Thank you so much. Thank you, Randy.
Pleasure. You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again with Dr. Ourian, you can visit our website at wellnesshour.com. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.